Many disruptive behaviors seen in children and adolescents may raise concerns that they are experiencing mental health issues. Common disruptive behaviors include hyperactivity, aggression, impulsivity, and irritability. I'm Dr. Stephanie Case, a child and adolescent clinical psychologist at Community Health Network. I'd like to spend a few moments discussing the impact of proper identification and treatment of disruptive behaviors in children and adolescents. It is important to understand that all behavior is communication. However, not all disruptive behaviors are an indication of a mental health condition. There are a variety of other explanations for disruptive behaviors, including stress, diet, inadequate sleep, age, learned behaviors, medications, substance use, and other medical conditions. Most mental health conditions have four main things or criteria that will classify an individual as having a disorder. These include time frame, disorder-dependent criteria, symptoms that cannot be a direct result of a medication, substance, or another medical condition, and the symptoms have to be impairing or distressing to the individual. When disruptive behaviors are observed, one of the most common clinical concerns among parents and teachers is a question of attention deficit hyperactivity disorder, or ADHD. Since ADHD is brought up so frequently, let's use it as an example to illustrate how to investigate disruptive behaviors. ADHD is a common disorder diagnosed in childhood. In fact, part of the criteria for ADHD is that symptoms must be present before the age of 12. However, this disorder is not as common as you may think. Only about 5% of children or adolescents in the general population actually have this disorder. To put that into perspective, in a class of 20 children, only one child is likely to meet full clinical criteria for ADHD. The most common symptoms associated with ADHD are inattention, hyperactivity, and impulsiveness. However, not all these behaviors mean a child has ADHD. A key consideration is that behaviors associated with ADHD criteria can overlap with many clinical diagnoses. ADHD actually has three subtypes: inattentive, hyperactive, and combined. To meet criteria for one ADHD subtype, 6 of 9 symptoms in that subtype must be present. Each subtype has its own 9 criteria, meaning there are a total of 18 symptoms across both subtypes of the disorder. What's more is that symptoms must be persistent for at least 6 months, and symptoms must occur in at least 2 settings. There are a number of other relevant disorders that can appear like the disruptive behavior often associated with an ADHD presentation. These include, but are not limited to, specific learning disorders, adjustment disorders, anxiety disorders, trauma, and even depression. A good rule of thumb is to think of a bad kid as a sad kid until proven otherwise. Here is just one example of how clinical disorders can be mistaken for something else if all the information is not considered. These are just the clinical considerations. What about other explanations for disruptive behaviors? Diet can be a factor. Have you ever heard the word hangry? It's a combination of the word hungry and angry. When blood sugar levels are low, disruptive behaviors may be present. It may be important to investigate if the child or adolescent has access to enough food in both the home and school environment. Another factor is sleep. Inadequate sleep or poor sleep quality can result in irritability, impulsive behaviors, poor judgment, and hyperactivity. Poor sleep can be due to a medical condition, a mental health condition, or environmental factors. Some disruptive behaviors may be due to developmental age. Not all young children have developed the ability to sit still, keep their hands to themselves, and pay attention. For those children who do not have an early education experience, they are learning a whole new system of behaving. Additionally, young children have not yet developed the words to express their internal state, and therefore behaviors may stem from stress they're experiencing but do not have the words to tell you. Disruptive behaviors can also result from learned behaviors. Children and adolescents behave in a manner based on what they know. The effects of medications can also contribute. Some medications carry unintended side effects. For example, treatment with steroids can increase activity levels. Finally, some medical conditions can result in disruptive behaviors. These conditions may or may not be currently identified. For example, a child who is diabetic can have blood sugar levels that are too high or too low, causing them to have erratic behaviors. As you can see, not all disruptive behaviors indicate a mental health condition. They can result from a variety of reasons. Understanding the why behind behaviors can be pretty overwhelming for parents or guardians to navigate. The good news is you don't have to do it alone. Many schools have started integrating social and emotional learning, or SEL, into their curriculum. The purpose of these lessons is to help children and adolescents identify and cope with stressors at a developmentally appropriate level. Your primary care provider can also offer guidance regarding clinically significant symptoms or behaviors, which may include a referral to a specialist. Some schools even have mental health professionals on site to provide greater access to services and remove barriers to care. If you have concerns for a child or adolescent, there are some recommended educational resources below. Remember, all behavior is communication, so identifying why disruptive behaviors are occurring is likely the best way to provide the necessary support.